So what's being offered in the amendment put forward by the member for Meadowlark, certainly in the D section, is standards for length of stay in the emergency departments of hospital consistent with the position statement on emergency department overcrowding published by the Association of Emergency Physicians dated February 2007. Very, very specific, measurable. And I think that's what folks are looking for right now. Something that's measurable, that's a clear target, that they personally can monitor and report on, and I suppose would look to the government to enforce. And you know, today we have another example. We've got Dr. Duckett, who was the one everyone loved to hate, and the government could point fingers and say, well, you know, government didn't do that. Dr. Duckett decided to do that. He'd point fingers back. Well, now Dr. Duckett has been terminated. Fine, so he's out. Now what does that tell people about whether this system actually worked or not? It creates more chaos, which I was trying to lessen in the system. But to be fair, I think with the cookie thing, that was just too far, and people will not accept it. He's lost the credibility of the staff and the frontline workers and the administration in the system and of the public, and he can't rebuild that. So it was probably, well, anyway. So I think that's why people are so interested in those wait lists. And I note that that Alberta never submitted their wait list times to the national program. So when they do the national announcement, and we hear how wait times are getting better or worse, and then they have to say Alberta's not in this, because we never gave our numbers to them. And that also puzzles people. If we're doing so great here and we've got such a great Made in Alberta system, why can't we put our numbers up against the national numbers? And the other thing that really shocked me was watching Alberta Health Services lowering the targets. So where they started, and the minister says the target's 95% on this, but if you watch Alberta Health Services, it starts to come down 85%, 70%, and it's now come down to something really odd, like 55% or 40%. Someone will correct me there. So I think that particularly the second section of this amendment is very good and speaks to what people are trying to grasp onto. And I know I'm interested in writing legislation. I spend a lot of time reading stuff like this. And I take the government's point that you've got to be careful about what you put in legislation, because what is done in the legislature must be undone in the legislature, or it can only be changed in the legislature. So, you know, if you say your wait time target is X, and it's for 8 hours, and it has to be, let me make some numbers up here, you know, 80% for people have discharged on the 8-hour mark and 70% discharged on the 4-hour mark. If you want to change that, even to lift it because you're doing so well, the bill has to come back in front of the legislature. And if you're not in the legislature, then it's, you know, it gets more complicated. So I understand what the government's trying to say about, you know, don't load too much stuff into legislation. But on the other hand of it, this government loads nothing into legislation. Everything is by regulation. We have had shell bills as long as I've been elected here, and we have very few decisions that are made on this floor.
Shell bills. Give me an example.
Oh, just about everything that's come in here, because the bills are 2 pages long or 3 pages long, and essentially they say, and the minister can decide what to do in the following circumstances, and there's a long list, and then it says, and they can make regulations, and that's empowered to the Lieutenant Governor Council or to the minister, and that's it. And so there's very little that's outlined by the bill itself, including the new Alberta Health Act is another example of a shell bill. I am struggling a bit, and I will look to the member for Meadowlark to explain this one to me. The C section of this talks about including as a guiding principles that no unnecessary deaths, no unnecessary harm to patients, no unnecessary delays in care, and no unnecessary waste of resources should occur. I'm not understanding what is the measurement there? How am I, as a citizen, supposed to figure out what an unnecessary death is? Is it any death? Is it a death that happens within a specified period of time?
Suicide,
Is a suicide an unnecessary death? That could be interpreted as a moral overlay rather than a physical overlay. So I'm struggling, to be honest, with the first paragraph because I can't figure out what the measurables are there. What are the targets? How do I measure that as a citizen when I look at, hopefully, numbers that are published by the ER? What do you mean, unnecessary harm to a patient? I'll tell you, you talk to my mother, sometimes you just get that close to her, like, kind of a quarter inch away from her skin, and she is so unnerved by that she is really uncomfortable. And you think, okay, did I cause her unnecessary pain there by almost touching her? So I'm really struggling with the lack of definition around the first clause, unnecessary delays. What the heck is that? If there's a fire alarm and everybody leaves the building and something didn't happen, was that a necessary or an unnecessary delay? So I'd even might want to recommend to the member that he look at severing these two so they could be voted on separately. But at the very least, if he would be so kind as to provide me with some measurables on that first paragraph.